So Congressman, we'll have a live audience on in just a minute. I'll do just a little introduction that I'll repeat a few times while we have people joining the call, and once we have a decent-sized audience, I'll go ahead and turn it over to you for your opening comments, and then we'll just go Q&A and polling questions from there until the close. Does that sound okay to you?
That sounds great.
Hello and welcome to our live telephone town hall meeting this evening. You're on with Representative Pete Gallego from the 23rd Congressional District of Texas. We'd like to take questions from the audience about veterans issues, so if you have a question on veterans issues, please press 0 on your phone right now or at any time during this call. And press 7 if you'd like to get email updates from the Congressman's office on this and other issues. If you would like individual assistance for an issue that you're having with the VA, you can contact our San Antonio office, and you can reach that office at 210-927-4592. And I'm going to repeat that number a couple of times throughout the event here, so don't worry if you missed it. Grab a pen and paper, and I'll read it again in a little bit here. I'm going to go through this introduction just a couple more times while we are being joined by thousands of your neighbors. Thank you for being on the line with us. This is a live telephone town hall meeting, and we'll be joined in just a moment by your representative in the U.S. Congress, Congressman Pete Gallego from the 23rd District there in Texas. He's here to answer your questions this evening, and if you'd like to ask a question on veterans issues, we encourage you to press 0 on your phone right now or at any time during this call. Again, if you have a question that you'd like to ask live of your congressman, push 0 on your phone right now or at any time during this call. The sooner the better. There will be plenty of people asking, so we'd love to get your question in as soon as we can. We'd like to take as many questions as we can in the time that we have. You'll also have an opportunity to give us your email address. If you'd like to get updates from the Congressman's office, you can do that by pushing 7. So again, 0 to ask a question, 7 to give us your email address and get updates. And if you'd like individual assistance for an issue you're having with the VA, you can contact our San Antonio office, and you can reach that office at 210-927-4592. And we have a well-funded caseworker staff there that is there to help you out with your issues you may be having. So again, if you're having an individual, if you need individual assistance with a very specific issue you're having with the VA, contact our San Antonio office at 210-927-4592. But we would love to take your questions live in this forum. So again, if you have a question you'd like to ask, press 0. Press 7 if you'd like to get email updates from the Congressman's office. And it's my pleasure to introduce Representative Pete Gallego. Pete, go ahead.
Well, good evening. This is Pete Gallego. I represent the 23rd District of Texas in the U.S. House. First of all, let me say that it is a huge privilege and honor to serve as your voice in the U.S. House. I want to thank each of you for being with us this evening. It's a telephone town hall meeting on veterans issues, and I hope to answer questions and provide additional information to veterans and constituents of the district regarding the current issues at the VA, and to answer any questions or concerns that you might have. I try to have telephone town hall meetings fairly regularly so that I can provide an update to constituents, and so that you know, so that you're aware of the work that we're doing on behalf of the folks in the district, you, your families, your friends, and your neighbors. So I want to underscore that during this telephone town hall meeting, you will have the opportunity to ask questions, and we'll also be conducting some polls so that you can let me know how you feel about certain issues. I think it's really important for me to know your views, your ideas, and that's really a core part of representing you and being your voice and your vote here in the House. So as we wait for others to join us on our telephone town hall meeting, let me talk about a couple of things with respect to what's going on here in Congress on some of the VA issues. I will tell you that from my perspective, what has happened in the VA and what we have found out is totally, thoroughly, and completely unacceptable, and things are moving that will change. As an example, the House voted on what's called the Department of Veterans Affairs Management Accountability Act, that allows the VA secretary to actually remove individuals from federal service or to move them to any different grade that's determined appropriate, so that the folks who are running the VA have the actual authority to hire and fire and move people, because frankly, If you don't care about veterans, if you're not committed to veterans, if you're not passionate about veterans, then you don't need to be working for veterans. That's, I think, a very basic premise, and one of the places where we have started just in cleaning up what has been a really, really incredible mess at the VA. So there are other things that are going on. For me, for example, I'm co-sponsoring the Veterans Access to Care Act because it is a huge area, a huge swath of Texas that we live in. That's in the 23rd district, and there are, people ask me, what is it that if this district is nearly a quarter, it's about just under 24% of the land area of Texas. So what does Marfa or Alpine have in common with El Paso or San Antonio? Why is Quemado or Eagle Pass? What does that have in common with Stone Oak or any of the other neighborhoods in San Antonio? And the truth is that what we all have in common is we all have a significant number of veterans that live in all of our towns and communities and all of our neighborhoods. And these veterans have essentially they've earned, it's not a freebie, they have earned not only our respect, but we have an obligation to pay them back for their services to our country. So one of the things that I have been really, really working on is to make sure that veterans get access to health care if they live more than 40 miles away, for example, from a VA medical facility. So that there's no reason why, for example, if you're a veteran in Del Rio, we shouldn't be using Laughlin Air Force Base as a place where we can give care. Or we should be allowed to use federally qualified health centers to be dispensing care. There's no need for people to have to drive all the way to San Antonio or all the way to El Paso, because for a lot of people, that's a day out of work, that's a hotel room, those are meals, and that makes it's just a really difficult thing. So for me, one of the important things is to push healthcare out into the field so that we get access to healthcare where our veterans live, and I think that's a really important thing to do, and to require the VA to reimburse providers who are not part of the VA system, so that you can go to a local clinic and get care, and the VA would essentially pay for that care at the same reimbursement rate that you would have gotten at the VA, or the same rate of reimbursement under Medicare, or the rate of reimbursement under TRICARE. But I want the VA to be contracting with these independent entities to be able to conduct assessments of the healthcare, report their findings, all of these kinds of things, so that we can build your medical record in other places. So that's the kind of stuff that I'm working on. I have a huge respect and appreciation for veterans, especially now with my service on the Armed Services Committee. I met the other day in Brackettville with a whole group of veterans, and it was a really great meeting and a fascinating time. There was a World War II veteran there who really reminded me a lot. My dad was a World War II veteran, and he would never talk about his experiences in World War II. He never really wanted to talk about it. And as I go, and now that I've visited Afghanistan several times and spent time with the troops, and just talking to them gently about what they see and what they feel and what they experience, it's become a passion of mine. I understand my father a lot more now, and it's become a passion of mine to make sure that our veterans get the care and the treatment that they need. So that's what I'm working on. I'm working on it pretty hard. I want to fix the situation at the VA. I want to make sure that it functions for the first time. One last point I want to make is that this isn't new stuff. There's been 17 or 18 times that an Inspector General has notified Congress that things weren't good at the VA. The American Legion, the VFW, all of these organizations have constantly complained about the VA. And I am here to tell you that I think it's time that Congress act on that problem and fix it once and for all. So, again, thank you all so much for being here and for being part of the call. And I'm happy to answer questions and get into a conversation about what's going on and what I think the future is.
Elmer's question first in a moment, but a reminder, if you'd like to ask a question, as Elmer is about to do, push 0 on your phone now, and we'll get as many questions as we can. If you'd like to get email updates from the Congressman's office, you can push 7 on your phone now. We'll get you with an operator so that we can keep you updated via email moving forward. Elmer, you're live on the line. Go ahead, please.
Congressman, I applaud what you're doing for the veterans, but I think there's one thing that's lost in the equation, and that is the money we're spending for veterans. I think there are a lot of veterans who would volunteer to work at the VA hospital to free up some of the money that other people are using for health care. I think if you reach out to the veterans and reach out and say, hey, can you volunteer, I think you'll find that many veterans will volunteer to work at the VA hospitals.
Well, I will tell you that it's funny that you mentioned that, because one of the other issues that I have worked on and am pushing is especially every medical corpsman who serves in any of the services right now at some point has gotten their training in San Antonio. Whether you're in the Army or the Navy, or whether you're in the Marines or the Air Force, part of your medical training has come to you in San Antonio. And so I think that a lot of people want to come back to San Antonio and want to come back to Texas. And so providing incentives for those folks to come back, I think, is very important. And I think you raised a really good point, because frankly, when I've talked to veterans, for example, about the difference about how they feel about El Paso, or how they feel about San Antonio and the health care they get, or how they feel about Kerrville, they feel a lot better about the Kerrville facility. And the difference, they tell me, is that the vast majority of the employees in Kerrville are vets themselves. And so if you have more vets working, I think the care and the treatment gets better. And so one of the things that we have been turning over in our minds is trying to figure out a way to make sure that we do, in fact, focus on getting more veterans to work in our system, so that they will treat their fellow veterans with the respect that they have earned and that they deserve. And I think that's an excellent point. And I think you're exactly right. We need to invite these veterans back into the system to come and serve their fellow veterans. I mean, I will tell you that those guys, they have each other's backs. The veterans community has each other's backs, and we need to invite them in and let them be of service again.
So thanks so much, Elmer. Appreciate that. We're going to get our next question up, and it's going to be from Dean. You're live. Go ahead.
Hello. Yeah, this is...
Go ahead.
Yeah, what I was wondering was all the bonuses that these people got paid out for doing such a poor job. I mean, I'm not against anyone getting a bonus, but when you do poor jobs and you sit there and you doctor the documents and the wait times and things like that, that's ridiculous. I mean, no business operates like that. Is there anything that can be done to make sure that doesn't happen again, or maybe you can get a refund back from the people who didn't deserve it? I mean, surely there's got to be something that checks and balances there that pays good employees but doesn't bonus bad employees.
Well, you're absolutely right. There's been reports recently that have indicated that some of the VA facilities maintained a secret wait list that was designed to essentially hide the fact that they were failing. The VA's own audit examined 713 VA hospitals and outpatient clinics, and they found that over 57,000 veterans have been waiting for more than 90 days for their first appointment. And over the last 10 years, 64,000 people who enrolled in the VA's healthcare system never even got an appointment. So when I met a couple of weeks ago, actually, in San Antonio with the guy who is now the acting secretary of the VA, a guy named Sloan Gibson. We met at Audie Murphy Hospital in San Antonio, and Congressman Lamar Smith, who also represents San Antonio, and Joaquin Castro, who represents San Antonio. We were all three there. And I made it clear that part of the challenge is that the VA's own structure, it incentivizes the wrong thing, so that you were getting a bonus if you saw X number of people. Well, heck, if you get a bonus for how many people that you see, you try to see more people, and when you try to see more people, you spend less quality time with them, so that you essentially become just this assembly line, and people aren't getting the medical care. So one of the things that the VA is doing, and frankly, I have already voted against those bonuses, and I don't think we ought to be doing that. They as an agency, they perform too poorly. Nobody over there at this point really deserves a bonus until we have time to reorganize and figure out where we are. But one of the systemic things that we need to change is that we need to incentivize good behavior instead of bad behavior. You shouldn't be graded by how many people you see. You should be graded by customer performance, customer appreciation. What do those people think of your visit? If you're the doctor or the receptionist or whoever it is, how do you treat people? And as people turn in they ought to be allowed to turn in their own evaluations of the VA staff, because that will give the VA staff an incentive to be a little nicer, to be a little more respectful, as opposed to, gosh, today I saw 1,000 people, that's X number of dollars of bonus. So if we can start incentivizing behavior and incentivizing the right things, because I will tell you this is a culture problem at the VA, and culture problems are harder to fix. You got to get rid of some people. You got to teach them a new behavior, and you got to incentivize the correct behavior. So you're absolutely right. We need not be giving those bonuses. I am completely, totally in agreement with that. And until we get things turned around, I don't think anybody over there deserves a bonus.
Question. We're going to go to Eugene's question next, but we've got our first polling question. We've got a number of these polls, so go ahead and vote using your touch-tone phone. We want to know, what should U.S. Representative Pete Gallego focus on during the current session? Press 1 if you think it's Social Security and Medicare. Press 2 if you think it's veterans issues. Press 3 if you think it's deficit reduction and budget issues. Press 4 if you think it's defense and national security. And press 5 if you think it's education. Again, what should Representative Gallego focus on during the current session? Press 1 for Social Security and Medicare, 2 for veterans issues, 3 for deficit reduction and budget issues, 4 for defense and national security, and 5 for education. And a reminder, you can push 0 to ask a question, 7 to give us your email address to get updates. And if you have a very specific individual issue you're having with the VA that you'd like to have one of our casework staff work with you on, you can call our San Antonio office at 210-927-4592, and I'll repeat that a little bit later in the call. Eugene's our next caller. Eugene, go ahead, please.
Yes, sir. The reason I was asking a question about this, but I kind of lost track on it a little bit. You were talking about bonuses, and I don't know, the next gentleman was just talking about that. But if people are going to get fired, that's what it was. If you're going to get fired on certain things, but also reassigned, aren't we just reassigning bad personnel? You know, that's what I'm looking at. If you're getting fired from one spot and pushed over to someplace else, why are we doing that? If they're in a high enough position, and I'm saying just make a level, say GS 12 and above, you make the bad decisions. 17 people already been confirmed dead, killed because they've been on a waiting list, and these people have been getting bonuses, and we're not going to fire them. We're just going to reassign most of them. That's just shuffling the pack.
Well, I will tell you, I am completely in favor of making sure that the people who, again, if you're not passionate about taking care of veterans, if it's not what you want to do, if you don't want to come to work every day for the reason that you want to make sure that veterans get taken care of and get treated with the respect that they deserve, then you don't need to be working for us. And you don't need to be moved to a job where you're going to do the same kind of thing somewhere else. So you may, there's only certain kinds of people that should work with people, because it takes a certain personality and it takes a certain conviction. And so I'm not in favor of transferring people and shuffling the deck, as you say, from one side to the other, because at the end of the day, if all of that rotates through, you end up back where you started. So I firmly believe that the only people who should be working with veterans are people who are committed to veterans and who are committed to their care. So I don't want to move them over. I mean, if you're working in the San Antonio facility and not doing well, I don't want you to go work in the El Paso facility because you're not going to do well there either. If you're working in El Paso, I don't want you to move to Kerrville because you're not going to work there either. If you're not committed to veterans, if you don't passionately believe in veterans health care and in giving people the treatment, the health care that they have earned, and in doing so with respect, you don't need to work for us. And that's one of the reasons that I voted for that bill that essentially undoes a lot of the civil service protections for veterans affairs for VA employees, because I want to start over. I want to clean house. I want to make sure that we're not just shuffling the deck and that 5 or 10 years from now we're going to have the same problem all over again. I want to get rid of people that don't want to be there, that don't need to be there, and I want to clean house. And that's why I did what I did. And so that's where my heart is. I mean, again, my dad was a vet. I understand so much more now about why he didn't talk about things and why he didn't do certain things. And I don't want veterans, especially now as we draw down out of Afghanistan and as we have a lot of folks coming out of Europe, and we're going to have a lot more people relying on VA services. We got to make sure that the VA is top-notch and that it knows that its only mission is to take care of veterans.
Eugene, for your question. Appreciate your participation. We're going to go to Euphoria next, but I want to run our next polling question first. We want to know, what is the best way for Representative Gallego to hold VA leadership accountable for the VA waitlist scandal? Press 1 if you think it's fire people who are responsible. Press 2 if you think it's reform the entire VA department. Press 3 if you think it's remove bonuses for senior VA leaders. Press 4 for all of the above, and 5 for no change needed. One more time, it's what is the best way for Representative Gallego to hold VA leadership accountable for the VA waitlist scandal? Press 1 for fire people responsible, 2 for reform the entire VA department, 3 for remove bonuses for senior VA leaders, 4 for all of the above, and 5 for no changes needed. We're going to go to Euphoria next.
Hello.
Euphoria, go ahead.
Congressman, my thing is that I'm a vet's wife. We had children, we traveled, VA has been really good, or had been really good to my husband, but he passed away 6 years ago from what I consider neglect from VA, because that's where he went from the time that he retired till the time he passed. But he passed over at Fort Sam. My question is what about the wives, the widows that are left behind? I have applied for some sort of benefits or something to help me support and maintain my house and whatnot, but I've been constantly denied. What can be done about that? We hear a lot about the vets, but not enough about the families and widows that are left behind.
Yes, I think that's very. I think that's a very important point, because, frankly, for all of the years that your husband was in the service, you served too, in the sense that you moved and you participated and you sacrificed, and all of the, for those folks who are on active duty, for example, who are parents, those kids that are growing up while their father or their mother is off on active duty. I mean, that's a sacrifice by the whole family, and the whole family deserves some credit. I don't know the specific circumstances of your case, but I can tell you that our casework staff is really, really, really good at working these kinds of things. And if there's a way to help you, we will definitely find it. We have had, over the course of the last 18 or so months, we have brought back to folks in the district a little over $2.7 million in money that the federal government owed them, and that's actually a little over 1.1 million of that was VA claims. People who maybe their impairment rating was wrong, or the VA was slow about responding to their claims, and so we have been able to get veterans in the district a little over $1.1 million from the VA. So if you will call, let me give you a number, and that number is the San Antonio office, and it's 210-927-4592. And they will take really good care of you. Ask for one of the caseworkers there, and essentially tell them what you've just told me, and they'll ask you for some additional details. You'll have to sign the privacy release so that we can ask the VA and the federal agencies about your case and figure out what was going on and figure out if there's a way to help you. But you're exactly the kind of person. I mean, I tell people all the time that the only part of politics I don't like is the political part, because the part that I do like is the helping people and the making a difference and helping people in their quality of life. And so if we can do anything for you, that's exactly what I want to do. So please call us. Please call that office number in San Antonio that I gave you, because if we can be of service, we will. If there's a way, we will find it. And, you know, we're not always, you don't win every time. I mean, nobody ever bats 1,000. But I can tell you that we will make every effort to do everything that we can to make sure that you are taken care of to the best of our ability. And if there's a way, we will find it. There may not be a way, but if there is a way, I'll assure you that we'll find it.
Yeah. We're going to do another polling question, but I wanted to read that number again that the Congressman just read for our San Antonio office. If you'd like to get in touch with some of our casework staff, you need individual assistance with an issue you're having with the VA. Again, you can call the number is 210-927-4592. Again, that's 210-927-4592, and I'll repeat that again a little bit later in our call. We're going to do our next polling question, then we're going to take Richard's question after that. We want to know, how should U.S. Representative Pete Gallego address problems in the VA healthcare system? Press 1 if you think it's hire more doctors and nurses at the VA. Press 2 if you think it's let veterans get their care at non-VA providers. Press 3 if you think it's let veterans get their care at community and rural health clinics. Press 4 if all the above, and 5 if no change is needed. Again, how should Representative Gallego address problems in the VA healthcare system? 1 for hire more doctors and nurses at the VA, 2 for let veterans get their care at non-VA providers, 3 for let veterans get their care at community and rural health clinics, 4 for all of the above, 5 for no changes needed. And again, if you'd like to give us your email address to get email updates from the Congressman's office, go ahead and push 7 on your phone now. Richard's our next question. Richard, go ahead, please.
The Congressman just covered the areas I was talking about.
Well, Richard, thank you for calling in, and thank you for participating, and thank you for your patience in hanging on the call. And if you're a veteran, I also want to say thank you for your service, because I know that we're hard.
Yeah, one of your aides is going to discuss with you about possibly using people that are trying to graduate from med school and stuff for different reasons, to use some of those to help out, catch up at the VA hospitals.
Yes, as a matter of fact, I've had a conversation that we're talking about some legislation that will open up the opportunities for folks to participate in giving health care, including the training opportunities. I mentioned earlier that everybody who has ever gotten any medical training in any of the armed services has at one point or another gone through San Antonio. And so the opportunity to bring people back and the opportunity to hire them to help. I mean, most people want to go back to places where they did their residency, for example. If you're a doctor, they'll stay there. They'll want to. And so if we can just take advantage of those opportunities and build some incentives into the system where folks will come back and help us provide health care, I think that's a win-win for everybody. I mean, there's going to be a lot of medics, for example, who have seen duty in Europe or in Afghanistan or in other places, that as they leave the service, who better would you want to see if you're a veteran and you need help and you walk into Audie Murphy? Who better than someone who can relate to everything that you have seen or been involved with and can help you? And so I agree. I mean, I think those are great ideas. and the staff is working with me on doing exactly that.
Thanks, Richard. We're going to go to our next question from David, but I want to ask our next polling question first. We want to know, how should Representative Gallego address problems in the VA? Next polling question is, have you personally experienced abnormal waiting time for medical appointments at the VA? Press 1 for yes and 2 for no. Again, have you personally experienced abnormal waiting time for medical appointments at the VA? Press 1 for yes and 2 for no. And our next question is going to come from David. David, go ahead.
Congressman?
Hello, David. How are you?
Yes, sir. Thank you very much for your service for us, what you've done for us so far. I really appreciate it. I see politicians and I fail to think, of what they're doing, which is nothing. And I see you trying so hard for us, and I really appreciate that right off the bat. First thing, I gotta say, I've had personal experiences with the VA. After finding out I had VA benefits, this is not given to you and told to you by when you get out of the service. They don't tell you you have help at the VA. It's all by word of mouth. I served during the Vietnam times, and I didn't find it out until almost 6 years ago about it. So, having said that, I noticed that the gentleman that before me talked about using medical students to supplement our care for the veterans. But I'm feeling that right now I've gone through the experience where I've had in the last 2 years 3 different providers. One, a doctor's about to retire, old man. Now the next one was a nurse practitioner, and the one I see now is a nurse practitioner. And I'm not getting the type of help that I need because I don't believe they know exactly what they're doing. And I believe that the thing is that I don't see us getting quality doctors at the clinics. Maybe at the hospital, yes. But my experience is that, no, we're getting subpar people working for the VA as far as practitioners. I'm sorry to say that, but that's how I feel because that's the way I've seen things. I've experienced through my own doctor, my own private doctor, was my medical condition. And when I took her to the VA as an emergency situation, the doctor there gave me a different diagnosis, totally different, which was even I don't know that much about medicine, but I know he was wrong because I've gone to my own doctor and I know what my condition was. And he gave me a different diagnosis, and then I saw him running out the door as soon as I finished at the emergency room. He was ready to go home. I believe that no matter how much money you throw something at, it's not going to make it better. We just need to find out who is qualified to do this, provide this service for the veterans. We need quality care, not just care that's subpar. That's not going to get it done. And another thing, and one more thing, Congressman, I know that people are waiting to ask their questions, is I understand why the lady I talked to you earlier about the widows. I know that, you have to be like 100% for 10 years prior to your death before the widow can get any benefits, because I know my father went through that. He's a World War II veteran. He never got to 100%. He was 70%. When he passed away, I tried to get help from my mother, and all the VA could come back with was $90 a month for my mom. Having said that, I understand the VA only has so much money. They're only allotted so much money by the Congress or by the government, and I know they're working within that.
See, that to me is key, David, because I will tell you that part of the again, the VFW, the VA, all of these veterans groups had been out there telling the Congress that these problems were there, and the Congress had never listened. And since I've been here, that's really what my deal is I want to listen, and I want to make a difference, and I want to fix this problem once and for all. But part of the deal with doctors, for example, is if you've gone through med school and you have your student loans to pay and you're trying to raise a family and you're trying to do those kinds of things, and somebody offers you, I don't know, $100,000 a year, and somebody else offers you $150,000 a year, then you're going to go where you make $150,000 a year. And the VA salaries, in many instances, have not been competitive, especially in some of the specialty areas. For example, we're really short on psychiatrists and psychologists. The VA is really short on a lot of the cardiologists is another example. And we have to be willing to pay the market value in order to get people to come work for the VA. And in order to pay market value, Congress has to let loose of the funds in order to meet the obligations that the government has to meet to treat veterans respectfully and accordingly. And so part of this, for me, has to do with the previous Congresses that have never listened. There's 17 reports out there that talk about challenges at the VA. There's a lot of notice. This wasn't a surprise. And if you are, I learned that you shouldn't do things halfway. That if you're going to fix it, you should really go in there and fix it. And part of the fix is getting and recruiting people who want to be there and taking care of your team, taking care of your employees by making sure that they are feeding their families and paying their loans and that they're making enough to exist on, so that the first time they get offered a raise, they don't run off and go work somewhere else, that we retain people so that you can have a history with the same doctor. I mean, as a little kid in Alpine, growing up, I saw the same doctor for a long time, but you just told me that in a couple of years, you've seen 3 different providers. And that's really bad for the continuity of care. So we've got to do something about recruiting and retaining our healthcare professionals. And frankly, we've got to do something even about the non-professional staff, the people that make the appointments, the people that are the receptionists, the people that do all of these other things. They've got to be receptive to veterans too. And again, it's a passion. You got to believe in what you do. You got to want to work there. You got to want to take care of veterans. And if you don't want to do that, you shouldn't be there. So that's generally what my thought process is.
Thank you, David. Appreciate you really much being on the line. A quick reminder, we have some folks waiting to ask questions, but we'd like to take as many as we can. If you want to ask a question of the Congressman, push 0 on your phone right now. And we have a few waiting in line to get their emails collected, but go ahead and push 7 and we'll get an operator with you as quickly as we can. So again, press 0 if you'd like to ask a question. Press 7 if you'd like to get email updates from the Congressman's office. And Susan is our next question. Susan, you're live. Go ahead.
Hi, I'm a veteran and I'm also a VA employee. And our director had a meeting with us a while back telling us that everything was just fine, that we only had a few people on the wait list, which I know is a flat-out lie. Is our director going to be held accountable for lying?
I think anybody who is in any federal government position should be held accountable for lying. I think, the idea that you would play with the lives and the health of those who served our country is unacceptable, period. Whether you're senior leadership or junior leadership or frankly you're not even in a leadership position, I'm going to hold you to a higher standard because you're taking care of veterans. And, if it's not what your passion is, if it's not what drives you to be there, then frankly, you shouldn't be there. So I have, as I said earlier, I have done several things in working with other members to make it easier to do away with some of the civil service requirements for VA employees so that the administration, the leadership of the agency can make some determinations. I've worked across the aisle with both the GOP members, the Republican members, and the Democratic members. When I met with the acting secretary there in San Antonio, Congressman Smith and Congressman Castro and I all did it jointly to show that this is a bipartisan issue. So I really believe that that folks should be held accountable, and that's why I'm pushing so hard. I want to fix this. I want to fix this once and for all. And let me say thank you for your service and thank you for being a veteran who's committed to other veterans. and understand that you have a lot of friends and allies who want to make the VA a much better system and a much better place for the veterans that the VA serves.
Susan, appreciate that. I'm going to go to Doris live next, but we want to ask you another survey question. How should Representative Gallego approach the VA budget? Press 1 if you think reduce veterans programs and spending. Press 2 if you think reduce spending without reducing federal programs. Press 3 if you think raise revenue and spend more at the VA. And press 4 if you think current spending levels are fine. So again, how should U.S. Representative Pete Gallego approach the VA budget? Press 1 for reduce veterans programs and spending. 2 for reduce spending without reducing federal programs. 3 for raise revenue and spend more at the VA. And 4 for current spending levels are fine. We've got Doris up live next. Doris, go ahead.
Hello.
Hello, Doris. How are you?
Hi, I'm fine, thank you. I want to tell you I appreciate what you're doing, I hope it makes a big difference. And I'm not really complaining, but I guess I am, because my husband passed away this past January. He was with the Flying Tigers, General Chennault in China during World War II. And
that's an amazing story. That's an amazing story. Wow. Your husband he lived through some history.
Well, yeah, he did. You know, he had a hearing problem because they used to bomb them pretty regularly, and they used to go out in the rice paddies, I guess, according to him, and they'd lie down out there, and bombs would be dropping all around them. Anyway, he never used the service of the VA. I don't know if he didn't know about it or why, but he didn't until 5 years ago, and he had, and I'm not even sure that. I think it was a kidney infection, or anyway, he had something wrong with his kidney, and he went there because a friend told him, why don't you go to the VA? And so he went there, and he saw a doctor, and I'm sorry that I don't know the full story, but he did not get any particular treatment, and they didn't want to see him back for a year. So he finally went to back to our private doctor, who took care of it. And he had a severe hearing aid, and I think that was from loss of being in China and the bombs dropping and things. And he bought hearing aids himself. We paid for them. And after a few years, he needed another pair. I think he lost one of the others. And we went to the VA, and he did get hearing aids, but they just didn't seem to work very well.
Well, I have heard this story before, two parts of it. When I was in Brackettville the other day, there was a gentleman who said that it took him so long to get his hearing aids that he finally did the same thing and went to a private provider. And not only that, but the VA, when they finally told him that they would give him hearing aids, they would give him one, which is just crazy. And so the VA needs to move faster and make decisions. And when people are forced to pay for a private doctor, then I think the VA has a responsibility to pony up and to help reimburse those folks for the fact that they had to spend out of their own pocket to get a service that the VA should have provided. I will also tell you that the other part of the story that I've heard before is this idea that you get one visit a year, because that's offensive to me. If you're sick, if you've got a chronic illness and you're diabetic and you have high blood pressure and you have a lot of things going on, the VA shouldn't be telling you get one visit a year. The VA should be telling you, you come back when you need us, and we need to make appointments for you on a regular basis so that we can monitor your care. So clearly there are some challenges with the VA healthcare system. I'm all in favor. I'm going to do all I can to make sure that they're not only accountable, but that we make them more efficient and that we make them better at providing the services in a way that you don't treat people like that. I mean, the Flying Tigers, that's a person who clearly earned the the government's help and who has earned all of our respect, and we shouldn't be treating people that way as a country, and that's something that needs to stop. Period.
Thanks, Doris. Really appreciate you being on. We're going to run our next polling question before we get to our next live question. Our next poll for you is, how do you feel about Representative Gallegos' work during the current session? Press 1 if you're very satisfied. Press 2 if you're somewhat satisfied. Press 3 if you're somewhat dissatisfied. Press 4 if you're very dissatisfied. And press 5 if you're indifferent. Again, how do you feel about Representative Gallegos' work during the current session? Press 1 for very satisfied, 2 for somewhat satisfied, 3 for somewhat dissatisfied, 4 for very dissatisfied, and 5 for indifferent. We're going to go ahead and get to our next question from Jack. Jack, go ahead.
Hello, Senator. My name is Jack. Been for a long time. I'm a Vietnam vet, double tour. A lot of things wrong with me caused from Agent Orange. I won't get into details. I'm receiving 90% now. Trying to get another 10% for the diabetes it caused me for an increase to 100%. And I'll be honest with you, I don't know how else to put it, but they just keep jacking me around, taking their time. I was told in January that if you already have a disease and you're currently being, given money for it and it's been claimed as a disability, then for it to be worse condition than it was before, it was only a 2 or 3 week program. Submit it to the VA, and more than likely they will approve it based on anything that you can submit as far as paperwork. That is not true.
Well, I don't understand. What I don't understand about the VA is why it is so hard to use common sense and to be more efficient, and why they need to drag their feet. They ought to be able to get to you and to get to you in an efficient manner and in a respectful manner, and it shouldn't take the VA so long to respond to someone who needs them. So what I'm going to ask you to do, Jack, is I'm going to give you a number. My office there in, I assume you're in San Antonio. So my office number in San Antonio is 210-927-4592. That's 210-927-4592. If you will call and ask for the casework staff over there and talk to them about your specific case, let us help you. Because again, that's what my favorite part of the job is the constituent casework. I'm not into the yelling and screaming and the pointing fingers that happens a lot in D.C. I'm into doing my job and helping folks. And if you'll let us help you, that would be one of the biggest honors. That would be one of the biggest privileges that you could give us.
Thanks, Jack. Appreciate being on. I'm going to go right to Gwendolyn next. Gwendolyn, you're up. Go ahead.
Hello, my name is Gwendolyn, and again, just like everyone else, I want to say thank you very much for putting this forum together for us to have the opportunity to speak. My question is in regards to the average claim processing time is anywhere between 13 to 18 months that I've been told whenever I call and speak to a representative. And I wanted to know, is there anyone that is looking into expediting this process? Because otherwise it seems, and I'm speaking in regards to my personal case and what I've heard from others, sometimes the cases, they go in, we do everything we do as a veteran. However, I've had 2 claims personally that were misplaced, and only because I was very diligent in following up with these did I realize, or was I informed, that one of the claims was nothing was happening with it, and another one was sent to the wrong VA office in another state. So is there some agency that is either already looking into the situation, or are there plans to look into the situation?
We are actually at a congressional level looking at. We've also met with the what's called the sub-cabinet level, which is under the secretary, the people that are actually running the various divisions. And I will tell you that the Waco office and the Houston office have prolifically been some of the worst offices in the country in terms of the time that it takes them to work on cases. Part of that, I mean, imagine if you're an employee and you have 100 cases and you can dispose of 10 a day, but the next day you have another 100. So now you got rid of 10, you got 100, so now you have 190, and the next day you have another 100 cases, and so they back up. And the challenge is to be able to, what I'd like to do and what I've advocated in my conversations with some of the members, is to have like a strike force of people who will go in, who will help the claims offices catch up with the backlog that they have. And we're looking at that backlog now because there shouldn't be those kinds of issues. The other thing, frankly, that I believe personally is that the burden of proof right now is wrong. We should assume, especially, earlier you may have heard a Vietnam veteran who participated in the call. Well, we should assume that the VA needs to help you, and in the event that it turns out not to be service related, then we can talk about that at some point. But in the meantime, you have a lot of claims that are valid claims, and a lot of people that are just waiting for their services that are backed up that are going to get it anyway. And so one of the challenges is to move those claims faster. It takes more people. It takes more resources. It takes a strike force. That's what I've advocated doing, because I agree with you. I mean, I think that's the root cause. I think they don't have enough people, and I think they assume they do everything that they can to make sure that you don't qualify so that they can save the government money. And while that's an interesting assessment, the truth is that they ought to start with a 180-degree different attitude, and that is their job is to help you get care, and their job is to find a way to make sure that you get the services that you have earned and that you deserve. And so I think we need to flip. Again, it's a culture issue over there. I think we need to flip that, and that's what I'd like to do.
Very much, Gwendolyn. Really appreciate that question. We're going to take Albert next, but wanted to remind folks out there who may have specific individual assistance issues and you'd like to use our casework staff at the San Antonio office. Roy and some other callers have some issues that are very specific to their individual case, and we'd like you to call our San Antonio office and get with a caseworker. The phone number to call is 210-927-4592. Again, that number is 210-927-4592 for the San Antonio office, and we encourage you to get in touch with our casework staff for issues specific to you, and they'll help you out. We're going to go to Albert next. Albert, go ahead.
Yes, thank you for having this. And my dad was a World War II vet. My wife's dad was also, and because of my dad, that's the reason I went in the Air Force, and I was a Vietnam vet. But my question is, not only do you take care of the vets, and I'm one of those that do volunteer as well to take care of the vets. I go out also to Floresville, to the veterans home there to preach, but to them have a worship service for them. But also is to take care of the families, because so much of the time there's not enough doctors for the families to be taken care of, and that's just as important to the veteran to make sure his family's taken care of.
Well, I hear you, and I agree with you. Interestingly enough, on the VA building, one of the quotes on the wall is the quote from Abraham Lincoln about caring for the widow and the orphan as a result of the he said that in the context of the Civil War. But that is just as true today. I mean, we need to take care of veterans' families. As I said earlier, they sacrificed too. They did a lot, whether you're the sons and daughters of a veteran or whether you're the spouse of a veteran. you deserve the respect of the nation as well. And that, frankly, I think is a resource issue. The Congress has never really fully funded the VA. It has been completely in this mode of trying to save money. And while it's an admirable thing to do, I mean, I want to do something about the deficit also. I will also tell you that there are certain obligations that need to be met. And one of those obligations that needs to be met is taking care of our veterans and our veterans community. That includes the spouses. And so I'm there. I agree with that entirely. And I'm going to work very hard to make sure that the VA is more responsive, not only to veterans issues, but also is more sensitive to dealing with veteran spouses and their families. And that's, I will definitely, I've always felt that way. I've always known that, but I will redouble my efforts as a result of this conversation.
Very much, Albert. Appreciate you being on the call. I want to give folks one last chance to push 7 if they'd like to give us their email address and get email updates from the Congressman's office. This will be your last opportunity to push 7, get with an operator, and give us your email address so we can keep you updated moving forward. We're going to take our next question from Keith. Go ahead.
Yes, how you doing, Congressman? My question is, well, the lady before answered the question. I was wanting to know why does it take so long for them to get the answer back? Because this July will be 1 year that they've been sitting on my case, and I had to wind up going to a Texas veteran representative on Lackland Air Force Base and sat for 3 hours with her to go through medical records to get everything to file this appeal. I put 3 or 4 appeals in, and they'll wait till the whole year, and they'll decline it. Well, this time I got some better help, and so I'm just now starting to get appointments, and this was this last July, and I'm starting to get appointments for that CMP stuff like that, you know, and it's taking so long. And if I try to call Houston to the regional office, you can't get anybody.
Keith, let me do this. I agree that's crazy. It shouldn't be taking that long. I do think I think they need more people. I think their backlog. I think we need to put a strike force in. I think we need to get some people so that they can catch up with their backlog. But the other thing that I will tell you is please let us help, because this is the kind of stuff that we want to do, that we like to do, and that we're very good at doing. Because if we call a couple of times, chances are that it may not take as long as it would have otherwise. So if Keith, you'll call that number that I gave earlier, 210-927-4592. That's 210-927-4592. That's my office at home there in San Antonio. And so if you can call them, ask for the casework staff. It shouldn't take that long to determine if you have the disability. So what I'm working on, again, is getting them the resources to deal with their backlog, number one. And number two, I want a cultural change in there. I want people who assume that you deserve the help and need the help and have earned the help, as opposed to people who are focused on trying to make sure that you don't qualify and that you don't get the maximum benefits that you're entitled to. I think you've earned them. I think that we need to give you the benefit of the doubt, and frankly, I think we need to give all the veterans the benefit of the doubt. They've earned it, and they've earned it through their service, and that's where I am on that issue.
Keith, quick reminder: if you'd like to ask a question, go ahead and push 0 on your phone. Push 0 if you'd like to ask a question, and Rachel's our next questioner. Rachel, you're up. Go ahead.
Hi, thank you. Congressman, it's Rachel. How are you today?
I'm good, thank you.
Thank you for your service. I really appreciate all that you do, and I especially appreciate your attention to the veterans' situation right now.
It's a huge issue
as you
for
know,
me.
I'm not a veteran, but I certainly have family members that are veterans and have been veterans, and I've been working on a lot of different with a lot of different veterans trying to address some of those issues, especially for the San Antonio VA, as you're well aware. So just a couple of things. I guess being rather cynical that I am, I guess, if we certainly now have verified that there is an issue with patient with the veterans being on waiting lists to get appointments, I have to ask, what else are they not doing correctly? What else are they doing that hurts the veterans from being able to get their benefits and get their full benefits that they're entitled to? And is anybody, looking into other things that need to be addressed? Because the horror stories that we hear out here in our area just are definitely, they're gut-wrenching. So that's one question. And the other question that I have is, just given all of the work that I've been doing with a couple of the advisory committees that I work with for veterans, it seems like the system, the VA system, is so convoluted, and the people that run the VA system at the federal level in D.C. truly have no handle and have no idea how each VISN is working, how it's functioning, and quite honestly, it just feels like a lot of the VISN directors aren't even held accountable for what is going on in their regions. So it just seems that system, however they have that infrastructure set up, has clearly added to these problems. So is there any conversations, are there any conversations being held to try to address that entire structure that it
absolutely
is not working?
Absolutely. Rachel, I mean, what is going on right now as a result of what has been found is essentially a top-to-bottom view of the VA. Every nook and cranny, I think, of the agency is being investigated to see how we can do it better, to see what else is going wrong, and to figure out what it is that we need to be doing as we move forward. So I think there's clearly a consensus that the VA is not doing well, and that the veterans community deserves better. And so I'm hopeful that this is an opportunity to rebuild, to start over, to make sure that those supervisors are held accountable, for them to circulate among their troops, and to make sure that in the future veterans are treated respectfully and that they receive the health care that they have earned and that they deserve. So that's where I am. I want to tell you all that I have taken notes as I've had conversations with each of you. I want to thank all of you for being on the call. We had actually, technology is an incredible thing. There were like thousands of people on the call, and I greatly, greatly, greatly appreciate it. I'm passionate about this stuff. I want to fix it. I want to make sure that we fix it in such a way that it doesn't come back next year or the year after that, that this is really something that we do, and we do it right, because the veterans deserve it. So I want to say thank you to each of you for calling, and know that I greatly appreciate your participation, your opinions, and your message. So thank you so much, each of you, from the bottom of my heart.
Those of you who didn't get your question answered, you felt you didn't get your question fully answered, please leave us a voicemail message when we close out this call in a few seconds. If you didn't get a chance to give us your email address and you'd like to still give us that, go ahead and leave your name and your email address in a voicemail, and we'll make sure that we get you those updates moving forward. Thank you again for being on the call. Thank you so much, Representative Gallego, for your time. Have a great evening, everybody.